We need to bring vaccines close to where people live. In low-income countries, large parts of the population have very long distances to sites where they can be vaccinated. In Nigeria, around 50% of the population, over 100 million people, live further than the government target of 2 kilometers from an existing vaccination site. Going to the right place at the right time is paramount to vaccinating as many people as possible during vaccination campaigns, which may take place over just 10 days. Our solution is to optimize the placement of vaccination sites. This is an area in the south of Kaduna State in Nigeria, all of it over 10 kilometers from the nearest existing vaccination site. This very precise information is now available on where people live and on the population density in each cell you see. We have developed advanced algorithms that use the population distributions and other data to provide optimized locations for vaccination teams to go to, which enables the maximum number of people to be within target distance from a mobile vaccination site, enabling more mothers to access life-saving vaccines for their children. And here's an example of such locations, including more than 1,000 people within 2 kilometers. And optimized locations like this we can produce for any area size, and we can adjust our algorithms based on preferences of vaccination planners, such as for specific age and gender demographics, or estimate the distribution of zero-dose children. In Adamawa State in Nigeria, our optimized site suggestions were used for COVID-19 vaccination last year, and this is the data. The 400 teams tried to reach as many people as possible, and as you see, they reached about 2,000 people per day in the beginning. And on day 45, they got access to our maps, almost tripling the number of vaccines they could provide per day. Dr. Hadley Ikwe at the US Center for Disease Control, who supports the government in Nigeria, was intimately involved in the work and provided this data. And he's been clear that the enormous boost you see here was the direct result of working in this data-driven way. Working closely with the Minister of Health and local planners in Nigeria, we want to rigorously evaluate, further improve and scale this intervention for pandemic and routine immunization campaigns. We want to make sure that every vaccination team in Nigeria knows exactly where to go. We want each of the 100 million persons in Nigeria living far from vaccination sites and all those in the same situation in other countries to be reached by one of the best and cheapest inventions of mankind, life-saving vaccines. Thank you.